we are going to discuss about clavicle bone. So first we will discuss about the side determination of the clavicle bone. So the clavicle bone has two ends. This is the acromial end or lateral end. This one is external end or medial end. So this is the acromial or lateral end is flat in shape. This one is flat in shape as we can see in this diagram. And this is the external end or medial end. This is quadrangular in shape as we can see in this diagram. Now this acromial end, as we know, this articulates with the acromial process of scapula to form acromioclavicular joint. Okay, now this is the external end. So this articulates with the clavicular notch of the manubrium sterni to form the sternoclavicular joint. Now we come to the shaft. So the shaft is divided into lateral 1/3 or medial. This is the lateral 1/3, and this is concave forward, and the other is medial 2/3. This is convex forward. Now we come to the inferior surface. So there is one longitudinal grooved surface on the middle 1/3 part of inferior surface is present. So these are the points on which basis we can determine the side of the clavicle. Now we came to the lateral 1/3 of the shaft of the clavicle bone. So it is flattened or flat in shape. So it has anterior border and one posterior border, one superior surface and one inferior surface. Now we come to the medial 2/3 of the shaft of the clavicle bone. It is rounded in shape. So it has four surfaces. This is anterior surface, this is posterior surface, this is superior surface, and this is inferior surface. Okay. Now the lateral 1/3 of the shaft of clavicle, this anterior border is concave forward and the posterior border is convex backward, and the superior surface is superior surface of the lateral 1/3 of the shaft is subcutaneous, as the inferior surface of the lateral 1/3 of the shaft has one elevation known as conoid tubercle and one ridge known as trapezoid ridge. Now we come to the medial 2/3 of the shaft of the clavicle. So the anterior surface is convex forward as we can see, and the posterior surface is concave backward. The and smooth, and the superior surface is rough. So this is the medial 2/3 concave convex. So now we come to the inferior surface. The inferior surface has longitudinal groove known as subclavian groove present on the lateral end, and the oval impression for costoclavicular ligament on the medial end. Now one foramen is present known as nutrient foramen on the lateral aspect of this subclavian groove. So as we can see in this video, we will discuss about the attachments of clavicle bone in next video. Thank you.